All right, welcome back to the deep dive. Today we're going to get into what it takes to be a behavior specialist.
Yeah, sounds good.
We've got this super interesting collection of 20 common interview questions and suggested answers. They're for people who want to work in behavior analysis.
Okay.
Our goal is to really, you know, analyze these and go beyond just the surface level. What do these questions tell us about the core skills and knowledge that are valued in behavior analysis?
Yeah, exactly. It's kind of like getting a sneak peek behind the curtain, like
Yeah.
what really matters in this field.
Right, exactly. So whether you are actually trying to become a behavior specialist or you're just curious about behavior change, this deep dive should be super helpful. Have you ever wondered what you absolutely need to know to be successful in a certain field? Well, that's what we are going to uncover for you right here, right now.
Okay, I'm ready.
All right, question number 1. It jumps right into a core concept, applied behavior analysis, or ABA. It asks about your experience with ABA and how you've applied it.
Okay, yeah, that makes sense.
So what's interesting to me is that they're not just asking if you've heard of ABA, right? You have to show that you can actually use it in real life.
Yeah.
It specifically mentions techniques like positive reinforcement, shaping, and functional communication training.
That makes sense. Yeah, I mean, it is one thing to be able to define these terms, but it's a whole other thing to actually explain how you've used them to help someone, right?
Absolutely.
And the example answer really gets at that, imagine being able to teach a child sign language
Oh, wow, yeah.
to give them a way to communicate their needs and improve their quality of life. That is so powerful.
Yeah, it's not just theoretical, right? You're making a tangible difference.
Exactly.
Okay, so question 2 asks how you would modify intervention plans to fit different people's needs.
Right. So this is interesting because it shows you that behavior analysis isn't like a rigid one-size-fits-all system. It's about being flexible and really assessing each person's unique situation. You can't just use the same plan for everyone and expect it to work,
Totally. The example they give about using visual cues to help someone during transitions really illustrates this. It's a simple change, but it makes a huge difference.
Yeah, that's a good example. It shows that effective behavior analysis is all about observation and personalization.
Exactly. It's really understanding the individual. Okay, so question 3 tackles a super important topic. Managing challenging behavior safely and effectively.
All right. Yeah, that's a big one. This is where the theory meets the real world.
Right, and the first thing that jumps out is that safety is the top priority here.
Uh-huh.
They emphasize the need to understand the root cause of these behaviors and to be able to de-escalate situations.
Right.
They even point out that having crisis management training and ABA certification are really important.
Makes sense.
So you have to think about both, the well-being of the person you're working with and your own safety too.
Yeah, definitely.
Okay, so question 4 is all about the power of positive reinforcement. This seems like a fundamental principle.
Oh, it absolutely is. It's about increasing desired behaviors by rewarding them when they happen.
Right.
And, it's not just about giving any reward. It's about understanding the timing and consistency of that reinforcement.
Right.
Like using a variable ratio schedule can be super effective, for example.
Right.
And the example clarifies that even further.
Yeah.
It's about figuring out what specifically motivates each person, whether it's praise, a tangible item, or something else entirely.
Right, and the example they give, it really highlights that. It's not just about any old reward. It's about understanding what that person values.
Yeah, you got it. It's about building that positive momentum, that trust in the relationship.
Right, creating a positive cycle. Question 5 shifts our focus to evidence-based practices, which are essential in any field that deals with people's well-being.
Right.
They specifically mention applied behavior analysis, or ABA, again,
Okay.
and cognitive behavioral therapy, which is CBT,
Right.
and dialectical behavior therapy, so DBT.
Got it.
What's key here is that these are not just random ideas, These practices have been researched and proven effective in addressing different behavioral challenges.
Yeah, absolutely. They're backed by science.
And it's not enough to just know the names of these approaches.
Right.
You have to have specialized training and stay up to date with the latest research.
That makes sense. Yeah, it's about having a strong foundation in these practices and being committed to continuous learning.
Right. They really want to see that you take this work seriously and you are dedicated to providing the best possible care.
Absolutely. Okay, what's next?
All right. Question 6 gets into the collaborative aspect of the field, because behavior specialists don't usually work in isolation.
Right.
It asks about times when you've had to collaborate with other professionals, like psychologists, psychiatrists, and social workers,
Okay.
to develop a treatment plan. So this highlights the importance of teamwork and communication skills, right?
Yeah, definitely. Being able to work effectively with a team is crucial.
The example they give is really interesting. It's about treating someone with anxiety and depression. And they describe this like multifaceted approach that involves individual therapy, group therapy, family therapy, and lifestyle changes.
Wow, so it's a really comprehensive strategy.
Exactly. And they also point out that you might encounter different opinions from different team members, so being able to compromise and find the best solution for the patient is really important.
Right, it's all about putting the patient's needs first.
Right. Okay, on to question 7. This one is all about ensuring that your interventions are actually effective and appropriate for each person.
So it's building on that idea of individualization, right?
Exactly. They talk about those evidence-based strategies again, like CBT and positive reinforcement.
Okay.
But then they emphasize the importance of considering individual factors like age, gender, culture, and lifestyle.
Right, you have to tailor your approach to each person.
Absolutely.
Okay.
And it's not a one-time thing. It's an ongoing process of assessing progress, adapting the intervention as needed, and staying current on the research.
So it's this dynamic process of constantly evaluating and refining your approach.
Exactly. It's all about ensuring the best possible outcome for the individual.
Got it. What's next?
Question 8 is about measuring a patient's progress over time.
Okay. Yeah, that makes sense. You need to be able to track whether your interventions are actually making a difference.
Right, and the answer provides some concrete examples of how they do that, like using standardized assessments, such
Yeah.
as the Vineland Adaptive Behavior Scales
Okay.
and the Autism Diagnostic Observation Schedule, or ADOS.
Okay, got it.
So it's not just a feeling.
Right,
There are specific tools and methods for tracking progress objectively.
right. They also mentioned setting goals, observing behavior, and documenting everything carefully.
Yeah, exactly. All of that information helps you see the big picture and make any necessary adjustments to the treatment plan. It's about making sure the intervention is truly working. Okay, question 9 explores how you would handle unexpected changes in a patient's life or environment.
Oh, yeah, that's a good one. Because life is unpredictable.
Right,
Yeah.
and you need to be able to adapt.
Yeah, you can't just have a rigid plan and expect it to work no matter what happens.
The example they give is about adjusting a plan after someone's living situation changed.
Okay.
They incorporated relaxation techniques and increased the frequency of sessions to help the person cope with the transition.
Right, so it's about being flexible and creative in your problem solving.
Exactly. And it highlights the fact that real-world behavior analysis is complex. You have to be prepared for the unexpected. Okay, question 10 deals with a difficult but important scenario. What do you do when someone isn't responding well to an intervention?
Yeah, that's bound to happen sometimes. Not every approach is going to be effective for every person.
Right, and this question is all about how you handle that situation.
So what do they suggest?
Well, they emphasize the importance of going back and reassessing the situation.
Right.
Like, are there any underlying factors that might be contributing to the lack of progress? Maybe the intervention isn't the right fit. So it's about exploring different options, maybe trying a different approach.
Makes sense.
And it's crucial to create a supportive environment, to
Yeah.
use positive reinforcement to build trust and encourage the person, even if things are tough.
Right. It's about staying positive and solution-focused, even when things aren't going as planned.
Okay, so question 11 is all about the specific techniques that behavior specialists use to help people learn new skills.
Right. What are the tools in their toolkit?
Right. And the answer really showcases the breadth of knowledge that behavior specialists need to have. They mention evidence-based techniques like ABA, CBT, and positive reinforcement.
They also mention the value of specialized training in areas like behavior modification and trauma-informed care. So it's not just about knowing a few basic techniques, it's about having a wide range of tools at your disposal to address different needs and challenges.
Right, they need to be versatile and adaptable. Okay, so question 12 focuses specifically on teaching social skills to children with autism spectrum disorder.
Okay, yeah, that's a common area of focus for behavior specialists.
And the answer highlights the need for patience and understanding, right?
Mhm.
Because children with autism might have different ways of communicating and understanding social cues.
Right.
So they suggest using very concrete and visual strategies like picture cards, role-playing, and positive reinforcement.
Makes sense. You need to break down social interactions into smaller, more manageable steps and make sure the child feels safe and comfortable.
Exactly. And they emphasize the importance of tailoring the approach to each child's individual needs and strengths. Question 13 shifts our focus to the importance of working with families.
Right. It's not just about the individual, it's about the whole family system.
Right. Behavior specialists need to be able to connect with families, understand their dynamics, and make sure that the treatment plan aligns with the family's values and goals.
Makes sense.
The answer talks about the importance of developing rapport with families, collaborating on the treatment plan, and ensuring that the family is actively involved in the process.
Okay.
They also highlight positive outcomes that can result from this collaborative approach, like improves communication, better social skills, improved school performance, and better regulation of behavior.
Right. So working closely with the family can really make a huge difference. Okay, so question 14 is a tough one. It's about having difficult conversations with parents about their child's behavior.
Right. This requires a lot of sensitivity and skill.
Definitely. You need to be able to approach these conversations with empathy and understanding.
The answer emphasizes the importance of building a strong relationship with the parents, listening to their concerns, and explaining the behavior in a clear and non-judgmental way.
Makes sense.
It's about finding solutions together, providing support, and avoiding blame.
Right. It's about working as a team to support the child. Okay, what's next?
Question 15 explores different strategies for motivating people to engage in therapy.
Ah, yes, motivation is key.
Right. How do you keep people engaged and invested in their treatment?
So what do they suggest?
They talk about using positive reinforcement, which we've already discussed.
Right?
They also mention goal setting, providing incentives and rewards, and incorporating fun and engaging activities into the therapy sessions.
Yeah, that makes sense. You want to make therapy a positive and rewarding experience.
Exactly. And it's about creating a supportive and encouraging environment where the person feels comfortable and empowered to work towards their goals. Okay, question 16 is about navigating ethical dilemmas in behavior analysis.
Ah, yes. Ethics are incredibly important in this field.
Right, because behavior specialists often face complex situations that require careful consideration and decision-making.
Definitely. You have to be able to think critically, understand ethical principles, and always prioritize the best interests of the client.
Exactly. They give an example of a dilemma involving the use of aversive techniques for managing aggressive behavior.
Okay.
And after researching and consulting with colleagues, the behavior specialist decided to prioritize positive reinforcement strategies instead.
Right. So it's about weighing the potential benefits and risks of different approaches and making ethical decisions based on the best available evidence.
Absolutely. Ethical considerations should guide every decision and intervention.
Makes sense. Okay, what's next?
Question 17 is about crisis intervention.
All right, so this is about being able to handle those really intense and challenging situations.
Right. Behavior specialists need to be able to think quickly, stay calm under pressure, and use specific techniques to de-escalate situations and ensure everyone's safety.
Definitely.
They give an example of a patient exhibiting violent behavior, and the behavior specialist uses active listening, calming techniques, and even some CBT strategies to manage the crisis.
Oh, so they really have to be prepared for anything.
Right. They need to be able to handle a wide range of situations effectively and safely. Question 18 revisits the topic of measuring intervention effectiveness, but this time it delves into more detail about specific methods.
Okay, so it's about taking a data-driven approach to evaluating the success of your interventions.
Exactly. They talk about using surveys, interviews, and focus groups to gather information.
Okay.
They also mention observational techniques and the importance of using evidence-based practices like ABA. So it's about continuously collecting data, analyzing it, identifying areas for improvement, and adjusting your strategies accordingly.
Right, so it's this ongoing cycle of evaluation and refinement.
Exactly. They want to see that you're committed to using data to make informed decisions and ensure that your interventions are truly effective. Okay, question 19 is about staying up to date in the field of behavior analysis, which is constantly evolving.
Right, it's important to be a lifelong learner in this field.
They provide a list of ways that behavior specialists stay informed. They mention reading professional journals,
Okay.
attending conferences,
Right.
joining online discussion groups, taking continuing education courses, and networking with colleagues.
That makes sense. You have to be proactive about seeking out new information and keeping your skills sharp.
Absolutely.
Hmm.
Okay, and finally, question 20 asks about the challenges that behavior specialists face and how they overcome them.
Right, because this work is definitely not without its challenges.
They give an example of working with individuals with a wide range of behavioral issues,
Okay.
and they emphasize the importance of using a person-centered approach,
Yeah.
creating individualized plans, and collaborating with the care team.
Right, so it's about being flexible, resourceful, and team-oriented.
Exactly. And they highlight the fact that even when faced with complex and challenging situations, behavior analysis, when done effectively and collaboratively, can really make a positive difference in people's lives.
Absolutely, it's incredibly rewarding work.
So as we wrap up this deep dive into these interview questions, what are some of the key takeaways for you?
Well, I think we've seen a few really important themes emerge,
Okay.
like the importance of a deep understanding of applied behavior analysis,
Right.
the need to tailor your approach to each individual's unique needs,
Right.
the crucial skills involved in managing challenging behaviors, and the power of positive reinforcement in promoting positive change. And beyond specific techniques, there's a real emphasis on using evidence-based practices, collaborating effectively with others, and always continuing to learn and grow.
Absolutely. And for everyone listening, I hope this has given you a better understanding of what it takes to be a successful behavior specialist and the complexities involved in this really important work.
Yeah, I hope so too. And it makes you think, considering how fundamental these principles are, understanding behavior, tailoring interventions, measuring progress, working collaboratively, what other fields could benefit from these same ideas? It's something to ponder, to think about how these principles could be applied in different areas of life.
That is a great question. And that is it for this deep dive. We will see you all next time.
All right, see ya.